Thank you for your wonderful attention so far here today. It's been a fantastic afternoon, and I know you are going to really enjoy hearing from our final presenter here this afternoon. It's titled An Introduction to Moral Injury. Dean Yates is the author of Line in the Sand. It is a memoir published a couple of years ago in 2023 that has been acclaimed by mental health and trauma experts right around the world. Dean was a long-time journalist and bureau chief for the international news agency Reuters. After leaving Reuters in early 2000, Dean ran his own workplace mental health consultancy. He has been a frequent public speaker on mental health and trauma, including his 3 admissions to the Ward 17 psychiatric unit in Melbourne from 2016 to 2018, where he was treated for PTSD. Dean helped persuade the Tasmanian government to introduce a legislation that made PTSD a presumptive work-related illness for state workers. Please, would you make welcome Dean Yates?
Thank you very much, Rick, for that kind introduction. I'm delighted to be delivering the final presentation. Just a health warning, some of this material may be confronting. Okay, can I just get a show of hands? Who is familiar with moral injury? Okay, that's encouraging. Moral injury has long been understood in military circles, but there is now growing interest in moral injury in Australian first responder communities, healthcare, mental health, social work, teaching and other frontline occupations. This interest is likely to increase even further when the concept of moral problems is added to the DSM-5 in September. The DSM, or the Diagnostic and Statistical Manual, is used in Australia by clinicians to diagnose mental health conditions. I hope people will take 3 things away from this presentation. 1, an understanding of moral injury if it's something you've never heard of before or it's something you don't know much about. 2, an appreciation of why you need to factor moral injury into the management of psychosocial hazards in your workplace. And 3, how the impact of moral injury can be mitigated. It's not always preventable, as you will discover, but mitigated. That's a sketch of me in Baghdad, height of the Iraq War, drawn by my eldest son, Patrick. A quick work history. I joined Reuters, the world's biggest multimedia news agency in Jakarta in 1993. I covered my first earthquake 3 months later on Sumatra Island. 200 people were killed. I spent 10 years working in Indonesia over 2 separate periods. I covered the Bali bombings. I had 3 assignments to Baghdad to report on the war in Iraq from 2003 to 2004. I covered the 2004 Boxing Day tsunami in Indonesia's Aceh province. I was based in Jerusalem during 2006, covered Israel's war with Lebanon. And I was the Reuters bureau chief in Iraq from 2007 to 2008, responsible for 100 people. Iraq at that time was in civil war. We lived in what was called the red zone. Sorry, there we go. We lived in what was called the red zone. That's me on the roof of the Reuters office in Baghdad. Those makeshift metal panels that you can see on the sides were erected to stop gunmen on rooftops seeing us from doing live TV interviews. 2 of my Iraqi staff, Namir Noor Eldin and Sayed Chum, were killed in Baghdad on July 12, 2007 in a US gunship attack. My final role at Reuters was head of journalist mental health and wellbeing. I created a mental health strategy for the company's 2,500 journalists around the world. While still working for Reuters, I relocated back to Tasmania in 2013 with my family, editing stories from my home in Avondale. I was diagnosed with PTSD in early 2016. I went on sick leave for much of that year. At one point, I became suicidal. Deeply concerned, my wife Mary insisted I go to the mainland for inpatient treatment. I ended up in Ward 17, a specialist PTSD facility in Melbourne for veterans, first responders, and others suffering occupational trauma. Just before that admission, someone suggested I look into moral injury. I'd never heard of moral injury before, but when I read about it, I knew that it applied to me. That was the start of a quest in which I used all of my journalistic skills to try to understand the psychological pain that I was in. This book, my memoir, which took 7 years to write, is partly about how I came to understand my moral injury. It describes my 3 admissions to Ward 17. My quest involved reaching out to some of the world's top experts on moral injury. I asked all my clinicians to look at the moral dimension of my trauma, which, to their credit, they did. Moral injury is what has resonated most with readers of my memoir since it came out 2 years ago. Few had heard of the condition before they read the book, but it has struck a chord. Now, I am not a clinician, but I feel very comfortable talking about moral injury because I've spent considerable time over the past 10 years understanding my own moral injury and how moral injury fits into the larger trauma context. I just want to pause for a moment, remind people to think about ways to ground themselves if they need to during this presentation. This is a photo I took of the Rapid River in the Tarkine rainforest in Tasmania, a stunning part of the state. So moral injury is a wound to the soul, a condition that shatters your sense of self. It's akin to PTSD, but is a distinct affliction that can occur in any occupation, in any walk of life. All that's needed is for someone's idea of what's right to be violated strongly enough. There have traditionally been 2 types of moral injury, but it's an evolving concept. There's a lot of academic research going into the topic. For now, it's simpler to look at the original definitions, which have very strong foundations. Type 1, perpetrating, failing to prevent, bearing witness to, or learning about acts that deeply transgress one's moral or ethical values. Type 2, the betrayal of what's right by someone. Now, this could be an individual, an organisation, a government, a system, who holds authority in a high-stakes situation. Moral injury is characterised by significant psychological, emotional and spiritual suffering and significant functional impairment. The term moral injury was coined by an American psychiatrist called Jonathan Shea in the mid-1990s, after he'd spent years treating Vietnam War veterans with severe PTSD. It's not that Shea didn't think his patients had PTSD, but what he observed was something beyond the well-known combat scenarios of life threat and fear. It was an indignant rage in men betrayed by their commanders in Vietnam and when they got home. He believed veterans could usually recover from the horror, the fear, and the grief of war if their notion of what's right hadn't been violated. It's that notion of what's right again. As Shea put it, he saw the absence of dignity in the indignant rage of his patients, and he settled on the definition of moral injury as the betrayal of what's right by someone who holds legitimate authority in a high-stakes situation. That's our definition from the previous slide. Shea drew parallels between his veterans and warriors from ancient Greece, in particular Homer's epic poems, the Iliad and the Odyssey. Moral injury remained a fringe concept until clinicians and researchers led by Brett Litz, a professor in the departments of psychiatry and psychology at Boston University, published an academic paper in 2009 that defined a second form of the condition among US veterans: perpetrating, failing to prevent, bearing witness to, or learning about acts that transgress deeply held moral beliefs and expectations. This may entail participating in or witnessing inhumane or cruel actions, failing to prevent the immoral acts of others, as well as engaging in subtle acts or experiencing reactions that, upon reflection, transgress a moral code. This has become known as Definition 1. We'll come to what's happening with the DSM in a later slide. I don't want to go through this too fast because I want people to understand just how widespread the risk of moral injury is. Moral injury can occur in any occupation, in any walk of life. All that's needed is for someone's idea of what's right to be violated strongly enough. That first grouping, up the top there, has been proven by academic research. Note the very high prevalence rate for healthcare workers during COVID. Now, you've got emerging research which links moral injury to those other cohorts. And while there is no research available, I suspect people in that last cohort are vulnerable to moral injury as well. I'm going to explain how moral injury type 1 can manifest through my own story. As I mentioned at the start, 2 of my staff were killed in Baghdad in a US helicopter attack on July 12, 2007. What you see on the screen behind me is a still image from the footage of that attack, taken from the gun camera on the Apache helicopter. That footage was made famous in 2010 when Julian Assange and WikiLeaks published it. Julian called the footage collateral murder. Many of you are probably familiar with the tape. I was the Reuters bureau chief. I was responsible for everyone's safety. Yes, it was a war zone, but 2 men died on my watch. And I believe I could have done more to prevent those deaths. So back to that definition of moral injury. Perpetrating, failing to prevent. Bearing witness to or learning about acts that deeply transgress one's moral or ethical values. When I read that definition of moral injury in 2016, it all fell into place. I'd failed to prevent the deaths of my Iraqi staff. Other elements of my moral injury also involve my failure to act, such as demanding that my employer Reuters call for an independent investigation into what happened. The key word here is failure to do something. Now, a lot of organisations recognise long service leave among their staff. I got this shiny piece for my 25 years of service at Reuters. Sometime before I got that service recognition, Reuters tried to throw me on the journalist scrap heap, tried to force me out of the organisation. They did that just a few weeks after my first psych ward admission. Before that admission, I had told Reuters I couldn't do journalism anymore because of my PTSD. A psychiatrist in Tasmania who had diagnosed me months earlier with PTSD had told me that the stress would be too much, but I also knew it in my heart. I knew my journalism career was probably over. Before that first psych ward admission, the Reuters Asia editor had agreed to my proposal to create a training and mentoring role that I would do when I was well enough to return to work. But someone somewhere decided that after my first psych ward admission that I was damaged goods. The promised new role was withdrawn and no other role existed because I was working remotely in Avondale near Launceston. The company tried to force me into the workers' comp system, sent me the documents to fill in. A case manager from QBE even called me. Reuters did this knowing I'd just gotten out of a psych ward, that I'd been admitted in the first place because I had been suicidal. They did this despite everything I had done as a journalist, bureau chief and news editor. I had risked my life on countless occasions, seen death on an unimaginable scale, and my family had made enormous sacrifices. I refused to fill in the workers' comp documents or speak with the people trying to force me out. I appealed to the Reuters global editors in New York who seemed surprised by what was happening in Asia. They eventually agreed to make me the organisation's head of journalist mental health and well-being. I suspect it helped that my battle with PTSD had become very public by this time. Nevertheless, this was moral injury type 2 for me, betrayal of what's right by someone, the organisation, who held authority in a high-stakes situation. That moral injury was harder for me to deal with than anything I ever experienced in the field, even the deaths of my staff. Moral injury first went mainstream when COVID-19 swept the world because it perfectly captured the dilemma for overwhelmed hospital staff. Who got a bed? Who got ventilated? Telling stricken families a loved one would die alone. Moral injury encapsulated the fury at hospital administrators and authorities for failing to provide enough personal protective equipment at safety guidelines that contravened individual ethics. Now, if I had more time, I'd ask 1 or 2 members of the audience to offer their thoughts on how they think moral injury might be a risk in their workplace. But instead, I just want you to think about that as this presentation proceeds. But what's really important is that we always speak about potentially morally injurious events. Like a traumatic event doesn't automatically lead to PTSD. It's the same with moral injury. It needs to be significant. Just going to have a drink before I get to the DSM-5. Are there any psychiatrists in the room? I hope not, because I might slip up on the DSM-5 and I'll be corrected. So, as I said, the DSM-5 is the Diagnostic and Statistical Manual. It's used in Australia by clinicians to diagnose mental health conditions. A year or two ago, more than a dozen US and Australian researchers and clinicians sought to have moral injury included in the DSM-5 in a formal submission to the American Psychiatric Association. Now, the APA took what this consortium called a historic step in December by approving the addition of moral to the existing religious or spiritual problem category in the section of other conditions that may be a focus of clinical attention in the DSM-5 TR. TR stands for text revision. This revision will take effect in September. Now, Z codes help clinicians document and understand the broader context of a patient's mental health, including the environmental factors that may be affecting their condition. Z codes are not diagnoses themselves. They are not a mental disorder. They are used in conjunction with other diagnostic codes to provide a more comprehensive picture of a patient's situation. As the consortium says, Z codes are meant to draw attention to the scope of additional issues that may be encountered in routine clinical practice. So if I just read what will be added to the DSM-5, this category, this addition, may be used when the focus of clinical attention is a moral, religious, or spiritual problem. Moral problems include experiences that disrupt one's understanding of right and wrong, or sense of goodness of oneself, others, or institutions. Now, the consortium says that this language corresponds to what they propose as a morally traumatic experience and instances of what they define as moral injury. Okay, my thoughts on this. Moral problem is imprecise wording, but I do think that this is going to take moral injury more mainstream and is going to pave the way for more research. In fact, there's already an explosion of research going on around the world, but I think this will unlock precious funding. I think the change, the addition to the DSM-5 is going to mean validation for sufferers. I think people will see that recognition is coming, and it will increase the validity of moral injury in clinical settings. But we still need a gold standard definition of moral injury and a universally accepted means to measure it. As we speak, there are multiple definitions and more than 40 different scales measuring moral injury and moral distress. And I doubt this change to the DSM will mean moral injury will be recognised in employment, legal or insurance contexts like PTSD is. The reason? Because the wording in the DSM is too imprecise. A fellow called Lindsay Carey, who's an associate professor at La Trobe University, is part of this consortium which is driving this change. He's also a senior chaplain in the ADF and a prolific author on moral injury research. He agrees on the imprecise wording, but he's confident that the words moral injury will be included once additional research has identified more clearly the diagnostic criteria. So I get asked about moral injury and PTSD all the time. What's the difference? Moral injury and PTSD can coexist. You can have one and not the other. But it gets tricky trying to disentangle them, work out the right treatments. The definition of PTSD can be limiting for some. What do I mean by this? The DSM-5 says trauma must involve real or threatened death, severe injury, or sexual assault such as rape to be called PTSD. This can be limiting because it's built around life-threatened fear. I don't think this captures the moral dimension of trauma. My own experience, I covered the Bali bombings, which is where that photo was taken. This messed me up psychologically for nearly 20 years. 202 people were killed, including 88 Australians. I interviewed multiple survivors, so I experienced repeated exposure to details of that event. But what it was for me were two things: the evilness of that event. I could feel the evil in the air. I could touch it. Secondly, while I did interview multiple survivors at the bomb site and elsewhere, I could not walk into the Denpasar hospital where all the wounded had been taken, including scores of Australians. I froze outside the hospital. I failed to do my job. I let my colleagues down. The other thing is that PTSD absolutely doesn't capture organisational and institutional betrayal. This review of 50 studies that I mentioned on the screen there shows that like PTSD is a risk factor for suicide, so is moral injury. Now, I've got this really flash slide here which talks about the overlap and the distinctions between moral injury and PTSD. I think it's an amazing slide. Lindsay Carey, who I mentioned previously, and his consortium have put this together. And what it shows is how the symptoms overlap and how they don't. And I just don't have time to go into this, but if the slides get sent around, I really highly recommend people have a good look at that, because if you want to understand how they differ and how they are similar, that's a great slide. But in a nutshell, how moral injury differs from PTSD is on this slide here. That is my spiritual care worker at Ward 17, the psych ward that I had a few admissions to, Kath Taylor. Kath helped me forgive myself over the deaths of my Iraqi staff. The pain is written on my face, while the empathy and the understanding is written on Kath's. What have I done? What have I failed to do? What did I witness? Let's take a look at healthcare workers, since I suspect that might be relevant for some folks here in the audience. If we look at the research, healthcare workers are among the most at-risk occupations in the world to moral injury, frequently facing moral dilemmas in decision-making on top of the trauma and suffering they witness. Now, research shows that healthcare workers are also increasingly exposed to avoidable moral conflicts because of organisational and systemic decisions. This is especially the case where a focus on the bottom line compromises care, resulting in healthcare workers being unable to provide safe, optimal, or even adequate care. That comment from the New South Wales psychiatrist says it all. To tell someone who is acutely suicidal that I cannot offer them a bed and to discharge them to completely depleted community services has caused me to experience a moral injury. Look very quickly here at a survey done of Australian first responders by the Reverend Mark Layson, an expert in moral injury. It was published in 2023. He surveyed 229 first responders. More than a third felt betrayed more than 50 times during their career. What is striking is how betrayal causes a far greater increase in suffering than trauma experienced in the field. This is in line with what every first responder I have ever spoken to has told me. More research. After that last slide, it's not surprising to see high rates of moral injury in police, although witnessing moral transgressions by others was higher than the organisational betrayal. That's a selfie of me taken outside the Ward 17 psych unit. I think it was 2018, my final admission. Now, I don't have data to prove the existence of moral injury among people who have experienced injustice with workers' comp, but hear me out. I'm just going to talk about first responders. This Beyond Blue survey was the biggest in the world, I think, of its type at the time, and I think the numbers speak for themselves. The survey also showed first responders found poor workplace practices and culture were as damaging to their mental health as occupational trauma. I've asked dozens of my veteran and first responder friends from Ward 17 what has been the hardest thing to deal with, their original workplace trauma or abandonment by their organisations, and then workers' comp DVA hell. Now let's remember what sort of trauma these people confront daily on the job. Every single one said betrayal by their bosses and the organisations that were supposed to help them recover was worse than what they experienced in the field. So, like I said at the start, you can reduce the risk of moral injury among frontline workers, but frontline workers will be exposed to potentially morally injurious experiences. Therefore, moral injury needs to be framed as a predictable occupational exposure in frontline workers. And organisational leaders need to recognise the consequences of organisational betrayal on employees. No organisation in Australia, not a single one, has a wellbeing strategy to address moral suffering, according to that 2023 research by the Reverend Mark Layson. Now, the Managing Psychosocial Hazards Code of Practice, 2022 by WorkSafe Australia, does not recognise organisational betrayal. It recognises PTSD, but not moral injury. But I think there is scope under the poor organisational justice domain to factor moral injury into the management of psychosocial hazards in your workplace. Let me just read this from the Code of Practice. Poor organisational justice refers to inconsistent, unfair, discriminatory or inequitable management decisions and application of policies, including poor procedural justice and interpersonal fairness. In other words, not treating people with dignity and respect. And we've heard this theme already today. And now you've got the DSM-5 change coming as an added reason to factor moral injury in. So as I said at the beginning of this presentation, bring the management of potentially morally injurious experiences in line with other psychosocial hazards. This is just another slide for healthcare workers. I got an email recently about the new model code of practice for the healthcare and social assistance industry a couple of weeks ago, dated July 2025. Some of you may have seen this code of practice. The section on psychosocial hazards has potentially morally injurious experiences written all through it, but doesn't name them as such. Nothing about moral distress or moral injury. It also doesn't address organisational betrayal. The last 2 points on this slide I think are common sense, but interestingly, they are also backed up by research, and I suspect would have applicability across any frontline organisation. When we talk about healing from moral injury, we need to assess what has been damaged. This is your starting point. Beyond the psychological symptoms, the inability to function, we are talking about a loss of identity, a loss of sense of self, being valued by others, being valued by the group, being valued by your organisation. Treatment-resistant clients with PTSD have been known to drastically improve, and I'm going to repeat that, drastically improve when moral injury was addressed as part of their treatment approach, says Dr. Nikki Jamieson, one of Australia's leading moral injury clinicians and researchers. What worked for me? Healing from the deaths of my Iraqi staff was a multidisciplinary process. I believed I was culpable over their deaths and found a team willing to help me through that. The team at various times comprised psychologists, a psychiatrist, mental health nurses, and of course my spiritual care worker, Kath. This culminated in a memorial service on the 10th anniversary of the deaths of my Iraqi staff at a hospital chapel near the Ward 17 psych unit. I went into that service seeking the forgiveness of my staff for not protecting them. Kath didn't tell me this, but she planned it so that I'd forgive myself, and that's exactly what happened. As for the Reuters betrayal, there was no apology, no accountability. I found my own ways to move on from that, partly by writing my book, telling my story, and never signing an NDA or a non-disparagement agreement. Just very quickly, if you or your organisation is interested in moral injury, check this conference out. It's in May of next year. And because I'm running out of time, I'm going to wrap it up there. Look, there are things your organisations can't control. You can't control the trauma that first responders will encounter on the streets. You can't control the trauma that presents at the ED. You can't control the complex mental health cases that will walk into your mental health consulting rooms, but you can control how your organisation supports the staff who deal with those situations. You can control the prevalence of organisational betrayal and the devastation it inflicts on your staff. Thanks very much. I don't know if there's any time for questions, Rick.
I think we could maybe take one or two if anyone would like to ask Dean a question. Just here at the front.
Yeah, that one there, sure. Yep. Please.
Managing some of, advising business about managing some of the stuff that comes out of our focus groups and our assessments. Organisational justice matters come out a lot. Internal violence and aggression between people within the organisation come out a lot, and in some cases more than what is experienced outside. And I use a little symbol of a house roof and say, let's look after what's going on here first, because they're more than willing to look outside and say, oh, it's all the client contact, etc. And the research is saying exactly what you're saying, that if you can keep home base clean and fair and a trusted place to be for the employees, they can be capable of dealing with just about anything outside. So making sure your own backyard is clean and works well and is fair is such a great investment in psychosocial risk management. So I think you've really nailed it with your presentation. Thank you.
No, I appreciate that comment. And one thing that strikes me is with all the, and I spent a lot of time in psych wards, and I met a lot of veterans, a lot of coppers, a lot of ambos. Every single one of them would do that job again. And I'm getting goosebumps thinking about it. They loved the job. They loved what they did. They loved serving their country, serving their community. But it was the way the organisations let them down that has made life so hard for them.
Dean, all I can say once again is thank you. Fascinating, real story. Thank you for sharing it with everyone here. And I've seen lots of nods of approval and lots of note-taking. I know there's so much to get out of it. And thank you for wanting to go back to that slide, because I think there's a lot of people that would be very interested in that happening in Launceston mid next year. So one more time, can we please hear it for Dean Yates?